আপনাদের ল্যাঙ্গুয়েজ ক্লিনিকে স্বাগত জানাচ্ছি। আজকে আমরা চিকেন পক্স নিয়ে পড়ব। চিকেন পক্স, the organism of chicken pox is varicella zoster virus. It is a DNA virus. Transmission of chicken pox: inhalation of airborne droplets, incubation period 10 to 21 days. Pathogenesis of chicken pox: the virus colonizes the upper respiratory tract. Over the next 2 to 4 days, it replicates in regional lymph nodes. 4 to 6 days later, a primary viremia spreads the virus to retino- reticuloendothelial cells in the spleen, liver, and elsewhere. After a week, a secondary viremia disseminates the virus to the viscera and skin, eliciting the typical skin lesions. Clinical manifestations of chickenpox: prodromal phase, fever, malaise, anorexia, headache, and occasionally mild abdominal pain. Rash: characteristic rash that appears after 24 hours of prodromal symptoms. Each lesion starts as a red macule and passes through stages of papule, vesicle, pustule, and crust. The appearance of the rash is described as a pearl or dewdrop on a rose petal. New lesions continue New lesions continue to erupt for 3 to 5 days. Lesions usually crust by 6 days, range 2 to 12 days, and completely heal by 16 days, range 7 to 34 days. While the initial lesions are crusting, new crops form on the trunk and then the extremities. The simultaneous presence of lesions in various stages of evolution is characteristic of varicella. Lesions may also involve the mucosa of oropharynx, eyelids, conjunctiva, etc. But corneal involvement is rare. Complications of chickenpox: brain, as for example encephalitis, particularly cerebellitis and cerebellar ataxia; skin, as for example secondary bacterial infection; lungs, as for example pneumonia; hepatobiliary, as for example hepatitis, pancreatitis; hematologic, as for example thrombocytopenic purpura; kidney, nephritis, nephrotic syndrome; joints, arthritis; heart, myocarditis. Treatment: supportive treatment of chickenpox is normal foods and fluids, no restriction. Paracetamol 15 mg per kg 6 hourly for fever. Management of pruritus: cool compression and regular bathing. Oral antihistamines such as diphenhydramine and hydroxyzine, topical diphenhydramine ointment, topical calamine lotion may cause excessive drying of the skin, causing the child to scratch. B. Specific treatment of chickenpox: oral aciclovir 20 mg per kg per dose, 5 to 6 hourly for 5 days. Varicella zoster immunoglobulin VZIG, recommended for immunocompromised children and newborns exposed to maternal varicella. Prevention of chickenpox: varicella vaccine, usually single dose, given after 12 months of age. Affected children should be excluded from school until the 6th day of rash. So that's all about chickenpox briefly. And if this channel language clinic is mainly meant for educational purpose, education is also entertainment. If you like education as an entertainment, you can join this channel, you can like, you can comment. So thank you very much, while wishing you all a good health.